Joining us now, CEO of Houston Methodist Hospitals, Dr. Mark Boom. Dr. Boom, it's great to have you with us this morning. Many people have made a comparison for where you are in Houston right now to where New York City was a couple of months ago, but there are a number of differences, namely that your patients are much younger, they're less sick, as you've described it, and your mortality rate is much lower. So what does it look like in your ICUs and your emergency rooms right now?
Well, it's gotten really, really busy. Let me tell you, since Memorial Day, we've seen 7 times the number of patients in a hospital bed across our system. So we're right around 700 patients right now hospitalized out of about 2,400 beds across our system. As you mentioned, though, there's a difference between this curve and the first curve. We got up to about 207 or so back in early April. And back then, half of our patients almost were in ICU. They were very elderly, high mortality rates for many of those older individuals. This time around, we're seeing many more younger people, and we're seeing a significant, and I mean less than half of the mortality that we saw back in the April timeframe. Some of that's just simply the math of younger people, but a lot of that appears to be advances in medical care that we've all learned through the last 4 months now that we've been taking care of patients with COVID. But this is spreading rapidly through the city of Houston. We see increases in hospitalizations each and every day so far. We're watching this with a great deal of concern, handling it with some stress for sure for our frontline workers. But 2-3 weeks from now, things will get very, very challenging if we don't bend this curve across the city of Houston.
And so what do you write that up to? How are the numbers have gone up among young people in your beds? You had older people back in April. Why are you seeing this influx of young people into your hospitals?
Well, I think Ms. Hernandez said it well in the clip that you just showed, which is people let their guard down. People started acting as if this virus wasn't here. We lacked the discipline as a society to say, for a long time, life's going to be unusual and not the way we would like it to be. And we just started doing everything like we used to, and this started spreading. And once it started spreading, it just amplifies. And it has hit all walks of life across the city of Houston. So, you can't point to one area of town or one group of people. It really is everybody. Definitely a younger predilection. I see that many of the older, more vulnerable people have been more careful staying home. Many of the younger people erroneously heard this message that, hey, this is about old people and old people get sick and die, but it's not about me. I don't get sick and I don't die. So let me run out there and do whatever I want to do. And the problem is, of course, if you get enough young people sick, some of them will get extraordinarily sick. Some of them will die. We had somebody in their mid-20s present this weekend to our emergency room and died within literally an hour. They were dying as they came in. That's just so sad, and it doesn't have to happen if we all have the discipline, if we all love each other and do what we need to do to care for each other as a society.
So if you had your way as a doctor, Dr. Boom, what would happen from a public policy standpoint right now in the state of Texas that would help slow this and keep your emergency rooms empty of those cases?
I think we've seen a lot of it over the last couple of weeks. We had 2 masking orders. Now we finally have one as of last Friday that really is masking everywhere outside of the home. That is critically important, and the evidence keeps emerging that that's probably the most important thing that can be done societally, short of a full shutdown, to control a virus. We're seeing some early signs in the testing data that we think some of the measures that have happened of late have started to help. So we're hoping that the lagging indicator of hospitalizations in the next 7 to 10 days or so will start to show the result of that flattening in the testing data. But it's way too early to say that. And of course, if we let our guard down, if we let our discipline down, we will have significant problems. I think we need to come to grips as a society that if we want to open, if we want to have things return to any semblance of normal, masks are going to be with us for a long, long time. So if there's one thing I think going forward we need to change, it's masks are going to need to be mandatory or pretty darn near mandatory everywhere, and we're all going to just need to wear them because they are highly effective from the data that keeps coming.
Dr. Mike Barnichel's here with a question for you. Mike?
So, Doctor, 2 quick questions. One, on the unfortunate, the sad circumstances of a 20-year-old dying in the hospital to COVID. Do we know whether that 20-year-old had any preconditions that might have led to his dying? in addition to the disease. And the other question is, and you just mentioned about bending the curve and perhaps getting to the point where we have mandatory mask wearing. We hear you, we hear many other accomplished physicians and scientists on telling us the importance of the mask and separation, but do you need help from public people, from the president on down, expressing how critical it is for people to be cautious, to be careful, to wear masks?
So let me take the second question first. What we need is unity. We need a country that rallies together like we all did early on in the first wave back in March and then into April, and links arms and says, okay, we're going to listen to the medical advice, we're going to listen to the medical evidence, and we're going to all do this together. So that's every political figure. It's frankly every actor, every movie star, every singer, everybody else. We need to make mask wearing cool. We need to make this the thing that we do for each other, that we show that, as humankind, as Americans, we care for one another, and we all just make that simple sacrifice. And my goodness, if I can wear a mask and I can save one life by wearing a mask, why wouldn't I wear a mask? I don't understand what the issue is. That's what we all should be doing. In terms of younger people, I don't want to talk about specifics, obviously because of privacy and other things, but in general, the younger people we see who get sicker, obesity is a major factor, oftentimes a couple of other medical comorbidities like hypertension, diabetes in the younger population especially. So when we look at our population under 50 who are getting particularly ill, lots of diabetes, lots of obesity.
The CEO of Houston Methodist Hospitals, Dr. Mark Boom. We know how busy you are right now and how critical things have become in the city of Houston. Thank you for your time, and we're sending our best to all of you down there. We appreciate it.
Thank you.
Coming up, Newt Gingrich said that President Trump's Mount Rushmore speech may have been his most important yet. Our next guest says it was Gingrich himself who pioneered that type of divisive rhetoric, how the former speaker laid the foundation. Next on Morning Joe.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.